And there are others there in the very early stages. A lot of different things. Within your lifetime, yes, this will be possible to grow whole organs within the next 10 or 20 years. Are there any human clones in the world? Well, depends what you mean by human. There are cell lines, there are tissues, but not complete humans. At this point, it's illegal, and it's illegal because it's that ethical question that I talked about last time. You know, is it you or is it something else, someone else? Okay. What about the law of abortion in Taiwan? Is it legal? Are there any restrictions? It's pretty easily available. Basically, you can go into a clinic. If you're a single woman, you can say, this baby is causing me personal psychological distress, and they say, sign here, and the abortion is done that day. If you're married, the husband's signature is also required, but that's it. It's very easy. And I read an estimate that says there may be 3 times as many babies aborted as there are children born in Taiwan right now. 1 out of 4 pregnancies ends in abortion at this point in Taiwan. Now, it may not be quite that high. It may be 2 to 1 rather than 3 to 1, but it's still, there are more abortions certainly than there are live births. It's difficult to tell exact numbers because the clinics don't have to release exact information about what they do. Okay, can we diagnose whether the fetus has a disease? It depends what you mean by disease. Disease, I assume you mean genetic disorder. Because most times you don't have a disease like a cold or whatever in the womb. So you're talking about genetic disorders. Many times that can be done. What's called amniocentesis. Amniocentesis, they stick a long needle into the woman's abdomen, and they take a little bit of fluid out of that sac that surrounds the fetus. That has some of the cells in it from the fetus. Just like we always lose skin every day, so does the baby. And so there are cells floating around, and they can take some of those cells and they can test the DNA. And so if someone has some forms of mental retardation, like Down syndrome, where they have an extra chromosome, if they have certain diseases like cystic fibrosis or cerebral palsy, that the chromosome is damaged in some way, or there's a gene damaged, those can be detected. And so a lot of people are using that to ensure that their baby is healthy. And they are aborting any child that is unhealthy. Now, I feel very strongly about this personally because my sister has Down syndrome. So if this had been done, I would not have had my sister. And I love my sister. And she has been a very important part of our family. And very, very few people are now being born with Down syndrome. It's changing society. And also, now you can test whether that fetus is male or female. And because of the Chinese desire for males to carry on the family name and burn incense at the family altar, more females are being aborted. If the family already has a female child and they want a male child, they test, it's female. That is being done by this same method. Are there any ways of performing abortion rather than stir up the baby's flesh? That's not a very scientific description, but it works. I'm going to show several slides that I'll talk about the different ways of abortion based on different times in pregnancy. I'm going to try to be scientific about it, not extremely graphic. If you want pictures, they're available online. I haven't shown them. But last time, at one of the last questions asked, what do you personally feel about abortion? And I said, I thought it's killing. And this will explain why I think that's true. Now notice, I said killing. I didn't say murder. There's a difference. Murder is specifically killing a human. And murder is punishable by law. That you have killed a human and you go to jail or whatever the punishment is for that. And I'm not sure that I would say that every case of abortion is murder. But definitely it is killing, and just like, you wouldn't go out and kill a puppy. I mean, I see all these dogs running around campus all the time. Nobody owns them, the stray dogs, they bother me. But it would be wrong for me to go and just kill those because I don't like them. Most people think that. And in the same way, I think that abortion is killing a living thing, whether that thing you want to count as human or not. And therefore, we need to think carefully about the reason for that. There are 7 different methods. The first 4, which happen before 24 weeks, are the most common methods. The other 3 are far less common. Okay, so just so that you can see, you said that your article said 20 weeks was the cutoff point for when abortion's legal in Taiwan, or where? Just in the movie. Okay. Swing. Okay. So in the movie Swing Vote, the cutoff point for abortion was listed at 20 weeks. At 20 weeks, this is what the baby looks like. It looks like a baby. And it's about that long, about 25 centimeters at that point. So up until that point, abortion is legal. And just to give you an idea, here, this is the umbilical cord, which I'll mention. This is the cervix. The cervix is the muscular, the muscle that closes the womb. Here's the womb or the uterus. The cervix is that muscle that keeps the baby inside until birth. And then this is the vagina or the birth canal. Most of the methods of abortion go in through the vagina into the uterus. Okay, so there are 2 methods of abortion that are used up until 12 weeks. 12 weeks, 3 months, first trimester. One is suction aspiration. Suction aspiration, they go in through the vagina with a machine that's like a very strong vacuum cleaner. And they simply vacuum the uterus out. And as that happens, the fetus and the placenta are just pulled into small pieces. Okay, the second one is called dilation and curettage. A curette is a hook-like knife. It's a knife that has a hook at the end. And they go in with this hook and they literally just cut the fetus apart. And then they scrape the side of the uterus and scrape everything out. That's probably the most common method of abortion. That's the stir it up bit. Okay? Dilation and evacuation is used up to 18 weeks when the fetus is a little bit older. In this case, the knife isn't strong enough. The bones are starting to harden, and so they need something stronger. So they use forceps. They use something that can clamp, because at this point, usually they need to crush the skull in order to bring it out. That's called dilation and evacuation. After 16 weeks, they often use saline injection. Saline means salt. And they just insert this very, very strong salt solution into the womb. The fetus swallows it and gets poisoned. And then once the baby dies, the mother's muscles just expel that dead or sometimes dying baby. Sometimes these babies are actually born alive. They're still moving, and they're just set to the side afterwards, because that's the mother's desire. Okay, those are the four most common. These others occur after 6 months, 24, 25 weeks. They're much less common. In some states in the United States it happens. I'm not sure about Taiwan, what the exact laws are here in terms of how late. But one is a chemical is used to cause contractions of the uterus. Very hard contractions. You know, when a mother gives birth, it starts gently. And so it sort of slowly pushes on that cervix. Okay, the cervix being that muscle that closes it. It slowly opens. And the mother is taught you can't push until it's fully open. And then you can push the baby out. But in this case, it contracts very hard, so hard that it snaps the baby's neck. And then the baby is born dead. In cesarean section method, cesarean section is when you cut the woman's abdomen, and if she has trouble giving birth, this can be used to help the baby be born naturally. In a C-section abortion, it's the same thing, but you make that incision, and then you first cut the umbilical cord. So the baby has no oxygen and dies. And then you take it out several minutes later. And then the last one is particularly gruesome. In this, it's called partial birth abortion. The baby is turned around inside the mother, so the legs are drawn out first, and the head stays inside. Because birth is defined as when the baby's head emerges. So if the head is still inside, they haven't been born yet. Then they take a pair of scissors and they snip the back of the head, and they insert a tube and suck out the brains. It's gross. This is murder. I don't care what anybody says. This is murder. How many of the others you decide are acceptable or not murder, that's a decision you need to make. But this is, to me, beyond anything that I can imagine people doing. Okay, those are the questions that we had in terms of technical questions. If you have any other follow-up questions on that, I'd be glad to answer them.
Are there any more questions before Dr. Brown's ready to leave?
I'll take that one off because that's too gross to keep looking at. Yes?
I don't have a question, but I want to share that because in Chinese culture we say that if the clone human being has different personality and different ways of and different memories because they are given with different spirits.
Mhm.
That the dead people were floating in the world, and
Right.
the other spirit in the same human body.
Right, and from a Christian perspective, people would say that a clone would receive a different spirit, not reincarnated as it would be in Buddhist tradition, but a different spirit, and therefore a different person. Yes, true. Other questions? Okay.
Okay, let's thank Dr. Jerry Rao again. Okay, so we're done with our previous topic. Some of you asked about the presentation today. I think Roya and her team has already prepared for their excellent presentation. I really look forward to it. They prepared very well. They will show you how to do it. All these questions are related to how to, but I just need to answer the very last question. Yes, everybody needs to write the assignment on the week of your own group presentation. So after the presentation, your group has to write the same homework. Okay. Now, let's turn to Group 1. Group 1 is going to talk about text message analysis.